And thank you for joining the Washington State Hospital Association Hospital Media Briefing. We're excited to be with you again this morning. Really appreciate your time. As we do every week, we are going to go ahead and take a moment to make sure everybody can record before we get started.
Recording in progress.
And Beth, if you could check your direct messages really quickly. Thank you.
Okay, are we good, Ryan?
Thank you all for your patience. Cindy, how are we on your end?
Good.
And Liz?
Doing good.
Wonderful. Let's begin.
Thank you. Good morning, everyone. I'm Beth Zabrowski with the Washington State Hospital Association. Thank you again for joining our media briefing. This morning, we have Taya Briley, who is the Executive Vice President of the Washington State Hospital Association. She is also a nurse and an attorney by training. We also are joined by Christy Carrington, the Chief Nursing Officer for Swedish Health, Mark Taylor, who is also an RN by training, Director of Operations for the Washington Medical Coordinating Care Center, based at UW Harborview Medical Center. And finally, we have Dr. Michael Mint, who's the Physician Executive for Population Health with MultiCare Health System. We're delighted to have them join us today and give a perspective on what seems to be a little bit more optimistic tone. So Taya Briley will give us the report from the statewide look at WSHA.
Great. Thank you, Beth, and good morning, everyone. Really appreciate your continued interest in what's happening with the hospital and healthcare system as we work to serve our communities during this really challenging time. I would like to cover a few topics this morning. I'll give a report on COVID-19 numbers and hospital capacities, talk about our work to prepare for the effects of the state's vaccination requirement for healthcare workers. I'll make a couple of points about COVID therapeutics, and then finally provide some information on caregiver burnout. So overall, there are signs of improvement with COVID-19 trends. If we don't stay diligent about the challenges facing the healthcare system, we are worried things could worsen again. There are 1,124 COVID hospitalizations today, compared with last week's number of 1,277. And while these numbers are decreasing, they are still very sobering. It's a roughly 12% decrease in a week, but we are still amid the peak of the worst of the COVID cases that we've experienced since the beginning of the pandemic. Of those in the hospital, 207 people are on ventilators, and this compares with 239 last week. And this number has decreased, but it still remains really high. And one of the things that we know about folks who are sick enough to be put on ventilators is that their survival rate is not what we would hope it would be. Folks really struggle once they're placed on ventilators. It's a last resort therapy, and we are not seeing great results. So this is not a number that we would like to be seeing this morning. Hospitals have reported 15 deaths in their most recent report. That's down from 29 that's reported last week. And it is a decrease that we are glad to see, but it is still a sobering number. Statewide hospital capacity is at about 10%. That means we are still very, very full. Occupancy is at 90%. And again, this is an improvement, but we are still very full. Looking ahead, we are concerned about factors that could continue to impact hospital capacity on top of COVID numbers. First is respiratory season and whether additional viruses like the flu could drive up our inpatient numbers, further stressing our hospitals. Second is the impact of delayed care from people that were not able to access care because of these COVID surges. And these folks get sicker, and when they need to access care, they are sicker and require a higher level of care. So We are concerned about the impact of those patients and their health status. And we're also concerned about staff shortages that can be driven by the upcoming vaccination requirement or just burnout overall. So those are some of the things that we are watching with respect to our COVID-19 trends. And then I wanted to talk a little bit about the vaccine requirements specifically. The state's vaccine requirement implementation date is coming up. By October 18th, all hospital staff need to be fully immunized or have an exemption, or they are no longer allowed to work. Today, October 4th, is the last day to get a Johnson & Johnson immunization and meet the deadline for full immunization, as that is defined in the governor's proclamation. And many staff have been vaccinated, and hospitals continue to provide education and support to their staff members about COVID-19 immunizations. And the experience of New York and California suggests that as we get closer to the implementation date, the vaccination rates for hospital staff do go up, and we are seeing some similar trends here in Washington. However, we are concerned about potential impacts on services related to staff shortages. And last week, we did an initial round of collection of information from our rural hospitals. And what that round of information is showing is that while there are likely to be some service closures and reductions, overall, we believe that services will remain open. And the real challenge is going to be if there's another surge or if there are other stressors on the healthcare system and how that will impact our hospitals and their ability to absorb those additional pressures. We are concerned about the upcoming vaccine requirement and its impacts on other areas of the healthcare system. We are concerned about the impacts on the emergency medical system, which transports patients to hospitals and between facilities. And you'll hear shortly from the Washington Medical Coordination Center, which plays a really important role level loading patients across the state. And that EMS service is integral to being able to move patients between facilities so that no one facility becomes overwhelmed. And in the past week, our hospitals have been reporting record high levels of patients that are ready to discharge to long-term care facilities that cannot get a spot in a long-term care facility. And this is despite efforts that are being made by the state to move those patients to an appropriate level of care, but the long-term care facility limitations on taking these patients are stemming from staffing shortages. And we are concerned that if these long-term care facilities cannot accept patients who are ready for discharge, our hospitals will then be unable to accept patients in need of true acute care. And so we are reaching out to our long-term care partners and the state to do all that we can together to address this challenge. And starting tomorrow, we will be doing another round of data collection from all of our hospitals, including the larger hospitals and health systems, with the goal of assessing the impacts of the vaccination requirement. And once we have those findings, we will report them to the Department of Health and to the governor's office. And it won't be until we have completed this round of data collection that we really have a clear picture of what the impacts are likely to be. And we will plan to share the results of this data collection effort with all of you on October 11th at our briefing. So as I said, we'll be working with our partners in long-term care and the states to better understand the situation with long-term care and support them and make sure that we can keep acute care open to those who need it. Another thing related to the vaccine requirement that I wanted to mention is we are eagerly awaiting more information on the federal vaccine requirement for hospitals. We are anticipating that later this month, we will see an interim final rule from the Centers for Medicare and Medicaid Services that will provide more detail about how closely that federal requirement aligns with Washington's requirement. The more closely aligned it is, the better for Washington state and our healthcare system as we will not have healthcare providers looking for more lenient requirements in other states and potentially leaving for that opportunity there. And then one other thing just to acknowledge with respect to mitigating some of these staffing shortages, we are really happy that the state has secured a contract with a national staffing agency to help where we are experiencing shortages. Just as important is securing funding for those staff, and the state is working to secure funding from FEMA for those staff, and we hope that those staff will be funded and on the ground just as quickly as possible. I wanted to make a couple of comments about COVID therapeutics. One is that we are really pleased that the monoclonal antibody supply for our state appears to be stabilizing and more accessible to hospitals and their patients. As a reminder, a couple of weeks ago, the federal government reclaimed its original role in ordering. The hospitals had been in a position of ordering directly from the manufacturers, and then the federal government has stepped back into its original role of facilitating the orders amid shortages of the monoclonal antibodies. And now that the transition back to the federal government has sort of stabilized and COVID numbers have decreased, the monoclonal antibodies are, the supply is freeing up some, and we are really happy that we will be able to get increased access to these life-saving drugs for our patients. And we're also really happy to hear that there's a new antiviral pill from Merck that is headed to the FDA for approval. But we also want to emphasize that the first and by far best defense against this virus is vaccination, and continuing to do all the other things that we know keep people healthy, like masking and social distancing. And finally, just a couple of comments on caregiver burnout. Our doctors and nurses have now been in the trenches for over a year and a half with COVID-19, and we've previously discussed on these briefings how taxing it is to care for these patients. They are really a lot of hard physical and emotional work when they're so sick in the ICUs, and the staff don't get a reward often enough of these patients surviving once they're that sick. And we are really seeing burnout that is also being exacerbated by challenges with some family and COVID patients in the hospitals, when they insist that they don't have COVID, when they insist on treatments that are not backed by medical science, even in at least one case that I'm familiar with in our state, having attorneys threaten doctors who don't prescribe certain treatments. This is exhausting and disheartening for our staff, and really want to acknowledge all that they have been doing and all that hospitals are doing to support their staff as best that they can, providing psychological support on site and remote after hours. Hospitals and their community supporters have been providing all that they can in terms of food and snacks, providing support for folks who are working those extra shifts by paying at premium rates. And one hospital board member that I was talking to just last week described organizing a parade of cars around the hospital to provide a little bit of additional recognition of caregivers during one of their shifts. And none of this is enough, but we hope that our caregivers can find some additional strengths in these shows of support. And finally, I just want to mention that if members of the public want to do something to support our caregivers, it is this. It is, don't get sick, get your COVID vaccine, get your flu immunization, wear your mask, do your routine doctor appointments, and take care of your overall health. And acknowledge all that our caregivers are doing and sacrificing to care for our community members. So with that, Beth, I'm going to turn it back to you and to our other esteemed panelists that we have here today.
Thank you, Taya. I think we're going to go next to Mark Taylor with the WMCC.
Yes, thank you. Thanks for the opportunity to speak to all of you this morning. Let me start by just explaining just a little bit of background with the Washington Medical Coordination Center, the WMCC. We set the WMCC up essentially to provide a backstop, a safety net for hospitals when confronted with a situation in which, as we're experiencing here with the pandemic, in which they are unable to find resources for the patient, either because of specialty care needs or higher level of care needs in their patient population, or in circumstances where they simply have too many patients at their facility to function normally, and their resources, their typical resource patterns, the transfer facilities that they typically transfer patients to, are also unable to accept their patients. In that circumstance, when they find themselves without support, we advise them to give us a call. It's a 24/7 operation in which they can reach out. We will basically find a resource facility within Washington State for that, the ongoing care of that patient. As Taya mentioned, with the goal of keeping any facility from becoming overrun and therefore providing a typical standard of care for all of the patients in Washington to present to our local hospitals. In essence, then, all of the calls that we receive are indicators of some stress within the hospital system. And fortunately, I tell you that, I guess I've set this background stage for all of you because fortunately, we are seeing lately some decrease in the number of calls that we're receiving to the Washington Medical Coordination Center day over day and week over week, which is a very welcome thing for us to see. As was mentioned, we have roughly 1,124 total COVID patients being treated in Washington State hospitals as of this morning. That is still, although down from our peak of just over 1,700 patients, that is still an incredibly high number of patients that are, quote unquote, extra in our state system. And given the challenges within the pandemic where care has been frequently or oftentimes delayed, where facilities attempt to support their patients in their community by getting care done when able. Occupancy in hospitals was already high before layering on top of our facilities, just over 1,100 patients. And that adds a significant amount of stress within our facilities, which cannot be alleviated except to provide the care that's needed and hope for a rapid recovery and treatment to create capacity within our healthcare system. I do also want to frame just a point of reference. At 1,100 patients that we have, we peaked at the post-Thanksgiving surge in December of 2020 at around 1,150 patients total. We are now just below that point. And although the numbers are coming down and we're feeling a little bit of capacity within the system, if we think back to almost a year ago, we were all feeling like 1,150 patients was an incredibly high number of patients to take care of in our hospitals. And it is. We fortunately now are seeing us decline beyond that point. But I think all of our hospitals, our healthcare system is working extremely collaboratively, has created some surge tactics and strategies to be able to care for this incredible number of extra patients in our system, but it is still a very, very high number of patients and a huge stress in our healthcare community. So the WMCC fortunately has been seeing fewer calls, and that is nice to see. We're receiving roughly 70 calls per week at this point in time. This from a peak of around 140 calls per week during the first 2 weeks or so of August. Around 40 to 45% of our calls are related to COVID patients. So again, while COVID is a component of the very, very high occupancies that we're seeing within our healthcare system, there are still other patients that still require treatment, whether that be for heart attacks, for victims of trauma, for patients who are having strokes that also need care. And because the healthcare system has some challenge, we may be called to assist with coordination of transfer for those patients as well, even though they may not be impacted directly by COVID. The COVID pandemic has in fact impacted their ability to get the care that they need immediately through normal transfer patterns. Again, I can't thank the healthcare community enough for the collaborative effort that everybody has put forward to strategize and work to accommodate the needs of particularly our rural and critical access hospitals in Washington State, as they frequently find themselves caring for patients in their facilities that typically they do not manage. These are patients that very frequently have very high acuities or need specialty services that are not available at those facilities, and they may have to manage those patients for potentially longer than they would need to, as we find resources facilities for them in potentially other areas of the state where beds are available. And I guess finally, I would just mention that, again, while we are seeing the general numbers of COVID patients decline in our state, and therefore finding ourselves with some elbow room, some capacity that is becoming available, we are in no means, we have not returned to a normal state of operation at this point in time. Hospitals are still extremely full. There are pockets of facilities that find themselves with very, very, very high challenges and difficult management decisions that need to be made for how they're going to care for the number of patients in their hospital. And that occurs from time to time in most of the areas of Washington State. Fortunately, we have been able to find resources, or they've been able to find strategies to be able to manage those patients for the period of time that they need to until they can resume normal operations. But we do find ourselves with our backs against the wall very frequently. So I just want to echo what Taya mentioned earlier regarding the public's ability to support healthcare community, utilize the practices that we know work, social distancing, getting vaccines, strategies that we know can reduce the impact or reduce the chance of spreading COVID to each other. We need to create some capacity. We need to reduce this number of COVID patients in our healthcare system through those methods, and that is ultimately where we will find the best in being able to make the most difference possible in our healthcare system. Thank you.
Thank you, Mark. Really appreciate those comments, and interested now in turning to Christy Carrington, who is at one of the facilities that has accepted some of those transfer patients over the course of the COVID pandemic. So Christy, can you tell us what your view is from Swedish?
Yes, good morning, everybody. And thank you, Beth and Taya, for including me in this conversation. So I would say for us at Swedish, we're definitely seeing a lot of what you're hearing here is, we're seeing this plateau and in fact, this drop in our COVID volumes. But we are still we continue to be very full. I think, where our biggest concerns are as we look ahead, of course, is we know we're entering respiratory season. We also know that if we've learned anything throughout this pandemic is that you can't predict what's going to happen next. There's always surprises that come around. But I would say that if you were to look at what's been happening with us and why we're so full, one of the biggest reasons is because if we look over the last 6 months, what we've seen is our non-medical necessity patients, patients who don't require hospitalization, that number has nearly doubled. In fact, in some cases, more than doubled. Some days we're seeing those numbers go more than what we've been used to seeing. Typically, we would see anywhere between 50 to 60 patients. on a given day that were non-medical necessity for a variety of different reasons, but patients that we can't get out of the hospital. And so a big component of that, as Ted pointed out earlier, is some of the staffing challenges that our post-acute facilities are experiencing. And so we've seen that number now increase anywhere between 90 and some days now we're starting to see that number peak over 100. And that's across all of our 5 hospital facilities. So that creates a lot of pressure for us. As we've started to see our COVID numbers start to trend down, our biggest area of focus has been to focus on our surgical backlog of patients so that we can continue to provide care to the patients who've been waiting and haven't been able to access our care. And that is a big concern of ours as we continue to focus our efforts there. I think that as we think about, how we're able to do that, we're continuing to look at our staffing, which is a challenge. And I know many hospitals across the state and across the nation for that matter have been really challenged with this. And, we're kind of at a point where I would say, we've been bending pretty hard. We haven't quite broken, I would say, but we've been very close on some days. And I know I speak for my fellow colleagues as well, who've been in those same shoes, but I, can't reemphasize enough the impact that this has on our staff. Oftentimes we're asking our staff to provide care in ways that are very different for them. It doesn't feel the same. And oftentimes when it doesn't feel the same as you would say normal, quote unquote, normal care for them, it causes a lot of moral distress for them as well. And that, while different from burnout, it adds to the burnout that they're experiencing. And so I think that as we continue to look at what is it that the community can do, it is all of those things that we've talked about. It's, staying healthy, it's getting your COVID vaccination, getting your flu vaccination, social distancing, all of those things we know that can prevent the spread of the disease, but also prevent the spread of any other respiratory illnesses as we start approaching into this flu season. And then the last thing that I would just bring up also is, just some of the unknowns that lie ahead of us, as we're, kind of in the tail end of, approaching the deadline for the COVID vaccine mandate. That's been a big area of focus of ours as well, right? That has led some unknowns for us, but we've been working really hard, as I know many other hospitals have been over the last few weeks, really try to get a sense of what do we project our staffing to look like, because that has the potential of further impacting our staffing. And so this has been the work of many of our leaders over the last few weeks. And what we've been able to see is that, we've actually seen our COVID vaccination compliance, or at least the vaccination rate, I should say, with our caregivers has increased over the last couple of weeks. So that's been promising and provided us with some optimism, but also just overall compliance with the government mandate is also been moving in a good direction for us. Now, I know that may not be the case for every hospital across the state. So again, just being prepared for, what some of those ripple effects may be for some of the other regions where maybe they aren't having as, good luck with compliance, or maybe don't expect to have as much compliance. But again, there's very much so that downward effect and that domino effect that we could potentially see from across the state, not just within our acute care hospitals, but also in some of the post-acute facilities. So those are some of the things that are on our minds as well.
Thank you, Christy. I really appreciate that perspective, especially I know you have teams that you're overseeing and really wanting to take care of them through this very challenging time. So thanks for giving us that perspective. Now I'd like to go over to Dr. Michael Min from MultiCare, and he's going to be able to tell us a little bit about what's happening on both sides of the state.
Yeah, thank you so much, and it's really a privilege to be part of this update. A couple of things, I don't want to repeat a lot about what Taya, Mark, and Christy had talked about already, but MultiCare is experiencing a lot of the same pressures and challenges, and I would just emphasize a couple of points. One, we are all really, really lucky to be in Washington State with such strong partnerships and collaborations across the state, including WISHA, but the networks, the DOH, our local health jurisdictions, really great cooperation throughout the state to try and prevent any one part of the state from going into more of a crisis standards of care. And I'll just emphasize that there's a lot of asymmetry across the state still, and anticipated that it will come. Our counties in South King counties for example, have been particularly hard hit, as well as our Spokane healthcare systems during this latest round, which was very different than last winter time. And so one of the things that we're going to want to make sure of is that we continue to remain resilient. The other things that I'll emphasize, we still are working through deferred medical care, like Christy mentioned at Swedish. And we were already very, very busy and very, very full before this Delta wave kicked in and really surged our cases. And I will emphasize what Mark mentioned earlier, that even though the curve is down, we are in multi-care, we're still at the levels that we were at the peak of last winter time and last respiratory season. So even though this is better, and we really had a remarkable surge of patients, we as a system are still at 180 patients who are COVID positive within our system, many in the ICU, including some of our pediatric patients in our Mary Bridge Hospital. And so our patients are very, very sick. The other part of our staff resilience that we're working on in conjunction with a lot of these partner organizations, and certainly with all of our medical professionals and care teams in our system, are that the COVID surge is really sort of two, right? It not only affects our staff when we're at work, but COVID doesn't let you off the hook when you go home, because you're still dealing with a lot of the issues that everyone else in the community is dealing with in regards to school, in regards to sick time, in regards to all of these. And so COVID is a constant pressure on the care teams. And I only want to emphasize that we're working very, very diligently to try to support our staff, not just at work, but also in the community settings. And again, it's been really great to see the community outpourings that have happened, community support. I really appreciate that parade around the healthcare facilities that Taya mentioned earlier. And those things are just are really kind of boosters for the teams. I will lastly just mention that from an epidemiologist perspective, I'm an infectious disease physician and an epidemiologist by training, and I maybe want to end with a little bit of look ahead. I completely concur with what all the speakers have mentioned. We know what works. But as we look across, especially with the global pandemic that we're seeing, there's a couple of things that give me pause, even though our rates are falling at this point. First, we're entering respiratory season, and traditional respiratory illnesses are not acting normal. RSV, for example, has surged in many parts of the country in a very atypical and not as it usually is cyclical during the respiratory season, especially in the Southeast. But even here in Washington State, we've seen an early peak in respiratory syncytial virus, which affects our very youngest patients, but also, immunocompromised other patients, including adults. Influenza has not yet really kind of poked across the country, but because of the atypical nature of what we've seen, I think we need a large amount of vigilance looking across the state, because even though, again, as the Delta surge that we see it continues to drop for the last few weeks, what has been seen in the UK as well as in Israel and other countries with similar vaccination rates that we have, sometimes the Delta wave has had several mini waves within there. So I wouldn't immediately just think that we'll see a Gaussian curve and the numbers going down. I think we have to be vigilant. One of the key things here in Washington State that we've been doing is continuing to emphasize the physical distancing, masking, and other interventions, which are so important. I just want to recall that last respiratory season, remarkably, we had 0 influenza deaths and 0 RSV deaths in Washington State, and actually very, very few nationwide because of these other initiatives. Remember, we did not have vaccines as of last winter time. These interventions do work. And as we continue to go through this respiratory season, it's going to continue to be important to emphasize vaccinations for those who haven't been vaccinated yet, both for COVID, appropriate boosters for COVID, and then influenza vaccines. And lastly, I would recommend wearing my population health hat, that we continue to try to work as a community to continue screening. The regular parts of healthcare don't go away when our hospitals are surging and our healthcare systems are full and we have staffing challenges. Patients continue to need screening and other important wellness initiatives. And I think that that's, again, it takes a village, it takes a community. The healthcare hospital systems are definitely all engaged in this work, but also working with public health and many other agencies across to make sure our communities continue to get the care and wellness initiatives that they need and deserve. So with that, I will hand back to Wisha, and again, really appreciate the opportunity to be able to give this update.
Thank you, Dr. Mint. Really appreciate it. We're going to be going to questions here, but I do want to check, is my audio better, Ryan?
It is slightly better, but not quite.
Okay, well, I'll just, if it gets really bad, shoot me a message and I'll turn it over to Taya to manage the questions.
Will do.
Thanks. Okay, so the first question actually is for you, Taya. Wanting to know how you are feeling about the vaccine mandate and how we're going to end up with hospitals. I think you spoke to this a little bit. I did let Kate know that we do not have the data yet. We haven't collected statewide data on how folks are doing with getting people vaccinated ahead of today's deadline for the Johnson & Johnson. But can you talk a little bit about what we are seeing in our conversations and any places that concerns are rising?
Yes, and as you noted, Beth, we don't yet have the data. We have wanted to be targeted in asking our hospitals to survey on this, knowing that they have a lot of reporting requirements already and a lot of pressures managing COVID patients. And so we really are zeroing in on this period of time after somebody could receive Johnson & Johnson as sort of the last opportunity today to come into compliance with the vaccine requirement by October 18th. And so later today, first thing tomorrow, we will be deploying a survey, and we will be able to share those results with you all at next week's briefing. We will be sharing those results with the governor's office and the State Department of Health to let them know what anticipated effects are. That said, we are cautiously optimistic with the numbers that not the numbers, but the anecdotes that we are hearing from our hospitals and health systems about staff choosing to become vaccinated as we get closer to the deadlines, following trends in other states that have had similar requirements put in place, New York and California in particular. And I would invite Christy or Dr. Mint to speak to their experiences at their healthcare facilities and what trends they're seeing. Might be some case examples for you all.
Sure, I'm happy to speak to that. So I mentioned earlier that, with the mandate, we have seen vaccination rates increase. So I would say before the mandate went in place, we were somewhere around, I think we were about 86% of our caregivers that were fully vaccinated. And as of today, we're at 92%. So you can see that shift has occurred with the mandate. And as far as looking at the requirements within the mandate, we're at about a total of 99% that will be in compliance, meaning 99% of our caregivers have either been vaccinated or they have met the requirements on an approved exemption, medical or religious. The remaining 1% that we have, there's probably a little more than half of that is just caregivers that we have an unknown status. And so we're actively reaching out and contacting those caregivers so that we know what their intent is. And then as far as the number of caregivers that we expect to leave the organization because they don't intend to comply with the mandate, it's less than 0.5%. So it's very few numbers. I think a total of 37, if you think about that in the greater scheme of how many caregivers we have. Like I said, that's less than 0.5%. So we're feeling also cautiously optimistic at this rate. I think we can just say we're optimistic.
Yeah, and I'll only just briefly say that our numbers mirror very much our fellow colleagues at Swedish healthcare system. So throughout multi-care, we are a little over 90% also in regards to fully vaccinated. We still are collecting data on those. Some of it is just a data issue where people have submitted, but we just haven't been able to aggregate all of that information. We do one of the, oh, well, I think we'll get to that question, but the J&J supply is pretty good that we have within our system to be able to give that dose today for those caregivers that have kind of waited till today and choose to get the Johnson & Johnson vaccine. And even with the medical and religious, strongly held religious belief exemptions, we are actually going to continue to reach out to these communities just to make sure that everyone's making that best decision that they can, and making sure that they stay safe, as well as we're able to keep our patients safe within our healthcare organizations with appropriate interventions for those who meet the medical and strongly held religious belief exemptions.
Wonderful, thank you. I just want to follow up with one point. I think one of our other concerns with the vaccine mandate right now and the deadline actually is in the long-term care facilities and the post-acute care facilities. We have heard that their vaccination rates were lower prior to the mandate than we had in hospitals, and we are concerned about what will happen there. As you heard, the lack of staffing there is already backing the system up into our hospitals, and with the mandate going into effect, we really are interested to see what impact that will have on our continued ability to move patients out of hospitals when they're done with their treatment. The other question that Michael Mint went to was about the availability of the J&J vaccine for people who want to get it today. My understanding at the state level is that we do not have a shortage of J&J, that it is pretty readily available. Christy or Taya, do you have anything else to add to that?
I can certainly add a little bit to that. So yeah, we have not had any challenges with supply of J&J vaccine. In fact, leading up to this week, actually, we were holding J&J clinics for our caregivers, and also just using that as an opportunity to help educate any caregivers that we may have who may have some vaccine hesitancy. We can educate them, not just about vaccines, but also even about the executive order on the mandate. And so we use that as an opportunity to educate, but also vaccinate our caregivers. And we had roaming clinics that we had all around our facilities to offer that to our caregivers.
Yes, and I would just say that part of the concern about access to Johnson & Johnson stems from a hold which was placed on ordering several weeks ago. But since that time, it has become much more readily available, and I have not heard of any hospitals that are challenged to access it right now. So I think that is good news for being able to get vaccine to our last minute folks who want to get vaccinated today.
Thank you. We'll stick on the vaccine trend here. We had a question that came in about what services are potential risk for being impacted by staffing issues due to the vaccine mandate going into effect. And Kate did ask me too about a little bit more on, are we seeing variability? I think anecdotally, there are some of our smaller hospitals that have some lower vaccination rates, and some that are doing just as well as what you heard from Swedish and Multicare. So do you want to comment, Taya, on what we've heard anecdotally about services that could be impacted by this and how our hospitals and health systems are dealing with them?
Yeah, and so right now, the best sense that we have comes from our rural hospitals, because we have done some early initial surveying of them. And far and away, the response that we are receiving in terms of potential effect to services is essentially needing to put a lower cap on inpatient admissions. So not so much needing to close down particular service lines, but not being able to take as many patients as they would have been able to take if they did not have staff who were unable to work due to the vaccine requirement. And so again, we're waiting to see final numbers when we survey all hospitals again this week, but so far the impact that we are hearing is more a limitation on access to acute care services than entire service line shutdowns. So I hope that's helpful, and we will have more information after we do the comprehensive survey this week.
And I'd only want to add just a little flavor to that. You know, what Christy mentioned in our estimations are somewhat are close to in line with that. But even if it's a small percentage of workers who choose to leave the healthcare profession, it really depends on where they are. And if they're in the post-acute care space, or if they're in intensive care or other units where we've been really heavily, you know, we've had a lot of demand on, those would have obviously a disproportionate effect on our ability to continue to care for patients at high acuity levels, especially those high skill positions like intensive care and truthfully necessary positions and high skill positions like skilled nursing facility post-acute care. So depending on how that goes, sometimes the numbers might belie the effect it has depending on where those shortages may come up.
I think that's such a good point, Dr. Min. And we are, as I described earlier, and as Christy described in more detail, very concerned about access to post-acute care for patients, sort of backing up into hospitals and affecting our ability to provide acute care to folks who need acute care. So we are going to be paying a lot of attention to that over the next interim period of time as we assess more fully the impact of the vaccine requirement.
I'm going to stick on the vaccine theme here. Clarifying question, do hospitals have J&J available for members of the public today, or do they need to look for health department clinics or drugstores? I don't know if we can speak to everybody, but maybe the two reps from the systems that we have on today could.
I can speak up for that too. So I think for general public, I would encourage those in the public to go to your community pharmacies, or I know that there's even some, clinics and offices that are physician offices that are providing access to vaccines as well. So I would just encourage members in the community to go to those facilities in those areas. They have J&J readily available there.
Yeah, and I would only second that. Vaccine Finder is still a good place to look, and then it does say what the vaccine is. I would only put just the warning in, just that some of the smaller sites, sometimes they'll list J&J, and just call ahead to those sites, especially today, because some of those sites don't have the supply. But go to Vaccine Finder, and some of our sites historically have had that, but we've tried to be very careful about the sites that we're listing that have access to which vaccines within our system.
Thank you. We have another question related to the same topic from Tom Bonsi with Public Radio. He says, anecdotally, at least, I'm aware some health systems in our state set an earlier deadline than the state of Washington did for staff to be fully vaccinated. These are systems that also have out-of-state facilities in California and Oregon. Do you have some sense for how many hospitals are ahead of the curve and how much of the medical population is using the October 18th deadline? Taya, do you want to take a run at this one?
Sure. We are aware of some hospitals who have been working on an earlier timetable. And we have heard from them that the result has been what we would hope in terms of having staff step up and go ahead and get vaccinated. What we have heard is that when staff have been removed from a schedule for work because they had not met a timetable for being vaccinated, that did a lot to spur immunization among those staff groups. So the earlier implementation date strategy did have that interesting effect of really driving folks to go ahead and get vaccinated. It is my belief that most of our hospitals in the state are relying on the governor's October 18th deadline, however, and so we will have more information after we survey this week. It is our strong hope and expectation that that upcoming deadline will drive a number of people to get across that final hurdle and go ahead and get vaccinated.
And Christy and Dr. Min, are you, your organizations, is October 18th the deadline for you?
Yes.
It is for us also.
Thank you. Now we're going to turn to a couple of questions about staffing. Taya, I hope that you might have this at the ready. I don't have it, but I can look it up. What's the name of the national staffing agency that's been contracted with the state? How much will those extra workers be assigned to hospitals and when will they start? Do we have, can you share what information we do have on that?
Yeah, so the staffing agency is ACI, and I can't remember what the ACI stands for. I don't know if any of our other folks on the panel may. And we are hoping that that federal funding will be available from the state directly to the staffing agency so that hospitals don't necessarily need to be in the middle of getting that payment taken care of. The state will then work with hospitals to direct where the staff go, and is working right now. And I know the Washington Medical Coordination Center, for example, was consulted on the highest need hospitals in terms of staffing, based in part on the need that they have had to reach out to the Washington Medical Coordination Center to request assistance in placing patients. And so, as I said, our hope is that this funding is identified and the funding flow and mechanisms are settled so that we can get these workers into our hospitals as soon as possible.
Thank you. A follow-on question to that is about the federal funding for these staff members that you mentioned the state is working on securing. Can you give more detail about that? Where does the money go? To the individual institutions? Is it meant to help hire outside help, or are there other uses for that?
I don't have details on that. We can work to provide more details. My understanding is that right now the funding source that is being contemplated is from FEMA, and that the payments would go to the staffing agency that has been identified, ACI, not to the individual hospitals. So that said, there is still a lot in flux, and I don't have details beyond that, but we can work to connect you with our partners at the state who are really working hard to try and put the pieces together on this to make it work.
Thank you. And I think also the staffing from the state for ACI has the potential to also be going to some of those post-acute care facilities too, and not just hospitals. Is that correct, Taya?
That is my understanding. And I think, you know, as we see the effects of this vaccine requirement, we're really going to need to get those staff deployed to where they're needed most. As Dr. Mint said, you know, staffing shortages in, you know, just particular places can have an outsized impact on the rest of the system.
Thank you. We have one more question in the chat box right now. Even with COVID hospitalizations declining right now, how concerned are you about the coming months? Do you think hospitals will have time to catch their breath after the surge, or will it stay very busy? I think it would be great to have each of our panelists to opine on that. Maybe we could start with Christy.
Certainly. Yeah, so I think, yes, absolutely. We are concerned about the coming months. Otherwise, I think we probably wouldn't be sitting here today having this conversation. You know, as we mentioned, we've got respiratory season right ahead of us. And as I, you know, pointed out earlier, I think COVID, if anything, has showed us that you can't predict the future. It really is dependent on, you know, human behavior in a lot of ways within the community that really drives what we're seeing. And some of that is, you know, we can't predict that, but continue to encourage and beat our drum of, you know, making sure that we have members of our community doing the right thing and just following the science. So I think that's the big thing for us. And the other component, again, is kind of some of those unknowns that we have in terms of the impacts of the vaccine mandate, particularly on some of our more rural facilities and even our post-acute care.
Thank you, Dr. Mint.
I, you know, second everything that Christy just said. And what I would say is that even if the Delta wave continues to ebb, even if the staffing isn't as affected as it could be, we were already anticipating that we would be very, very busy through the, you know, through the winter time, even if it wasn't for influenza or any of these others. So I would say that all of our facilities, and I know that many others, and including our Swedish colleagues and UW Health and CHI, VM Franciscans and others, we were all pretty full even before the Delta surge. Delta surge created a latent demand for some of these more elective procedures, which we'll be working diligently to work through, even if there's not a surge. But healthcare itself throughout Washington State has all of these unknowns, all of which could continue to very much stress the system. Our colleagues at WMCC and others can help to level load that throughout the state, but the state still has capacity constraints just inherently. We also are, on every side of Washington State, including Alaska, not contiguously, but we also have, communities that had gone to crisis standards of care and have other needs, and we do our best to really help serve not only our Washington State citizens, but also our broader communities of people needing, the kind of care that our facilities can provide, tertiary quaternary care. So we are, concerned about this wintertime, because any of those other things, in addition to that, would either continue to defer some care, which we would really like not to do. Hopefully, the staffing assistance and some of this level loading will continue to allow us to be able to serve the communities in the way that we want to and the community deserves. But we do have great concerns about all of these variables. And to Christy's point, COVID has continued to surprise us. So we remain vigilant and continue to prepare for what might be a pretty long respiratory season.
Thank you. Mark, do you have anything to add?
I think, fortunately, Dr. Mint and Christy have covered most of it. Just to reiterate, though, I think what we learned from the spring, we had a brief spring surge in April of 21 that subsided through May and June. During that time frame, Dr. Mint spoke to this. It gave hospitals an opportunity to provide some of that deferred care that was deferred from our previous waves. That resulted in hospital occupancy remaining high, even though COVID numbers did decline during that period of time. And I would anticipate that this, although we currently are still very, very high, very, very full with COVID patients, I would anticipate that as COVID numbers, if we are lucky enough to see COVID numbers continue to decline, that hospital occupancy will still remain very high throughout Washington State. And I also agree completely regarding our neighboring states, which are also severely impacted, as is Alaska. There are multiple patients that are in facilities in those states that are also reaching out to Washington State hospitals to seek care simply because they cannot get care in their home state. And to the degree that Washington State hospitals are able to support our neighboring states and neighboring communities, that will absolutely happen if possible. So I think we do need to remain very, very vigilant, even though we are fortunately seeing a decrease right now in COVID numbers, occupancy, and the broad impact of the pandemic forces us to exercise an extreme amount of caution moving forward.
Thank you. And I think one point that I just want to reiterate with everyone is that without the pandemic, Washington State has a very efficient healthcare system. We don't have a lot of excess capacity naturally built in. We have one of the lowest per capita hospital beds in the country. And so there just isn't that excess capacity sitting around. And as Mark said, we remain very high. So we appreciate you all continuing to do your part to prevent us from having future surges and for continuing the downward trend here today. I think we are at the end of our time, and I really want to thank our panelists for coming and being with us and giving their perspectives. And we will be here next week with the results of that vaccination survey. So everyone be well and stay safe out there. Thank you.